Good afternoon, everybody. We are live on Wednesdays. Today is September 16th. Hope everybody's doing well. Today we are going to talk about gut health and absorption and why the different things that makes, why it's important, how it affects the rest of our body. Yes, I am outside, because it's just too nice to be inside. So I apologize for the extra, sorry about that. I apologize for the extra road noise. We do have a lot of construction going on in our area, so there are a bunch of construction trucks that are going up and down our road here. So sorry about that. So I will get going right away. So how does gut inflammation, irritation affect the rest of our body? One way is by the absorption or the lack thereof, malabsorption of nutrients. So there are a lot of different gut conditions, gut issues, diseases that contribute to inflammation. I'll just name a few: Crohn's, celiac, IBS. As I said, those are just a few. But if anybody has these conditions, you can maybe relate to what I'm about to talk about. These things can affect really every part of our digestion, but primarily they may focus specifically on the small intestine because that's where absorption takes place. But keep in mind that our stomach is also part of the digestion, so if our stomach is not breaking down the foods appropriately, then it's going to be even harder for an inflamed small intestine to absorb the nutrients that haven't been broken down properly. So there's always a lot of different areas involved in things. So I'm going to talk about the nutritional deficiencies that can happen when malabsorption takes place, or when we have malabsorption. So, and what can contribute to these deficiencies? Okay, so besides the fact that we have these conditions in our digestive tract, the inflammation in itself can contribute to malabsorption. But add to that, if anyone has used prednisone or is using prednisone, which is a corticosteroid, that can contribute to a zinc deficiency. And keep in mind, prednisone is something that's commonly, given for the inflammation to try to bring it down, reduce it, get it under control. But it can contribute to a zinc deficiency. And why is that important? Well, a zinc deficiency can contribute to loss of appetite, hair loss, diarrhea. And if you have chronic diarrhea, that you're not absorbing because it's all being flushed out of you. Prednisone can also contribute to potassium, a potassium deficiency. Potassium is really one of our electrolytes that are very important to our body. It specifically helps to make it, if you have a deficiency with potassium, your muscles might be weak, they might be twitching, they might be cramping up. In another case, they could just make your body feel like it has weights all over it, like it's just weighted down, gravity is pulling at it. Abnormal heart rhythm. A potassium deficiency can contribute to abnormal heart rhythm. Okay? Something else that can happen due to malabsorption is fewer calories than are absorbed. And because there's fewer calories, that means that there are fewer carbohydrates, protein, and fats. Also, vitamins A, D, E, and K will not be absorbed as efficiently. So one of the reasons for that is, you need fat sometimes to be able to absorb some of those vitamins. You have water-soluble vitamins, which are your B vitamins, and then you have fat-soluble vitamins, okay? Something that contributes to malabsorption can be certain medications that anyone with these conditions might be commonly prescribed. One specifically is cholestyramine. I'm not sure if I'm pronouncing that right. Cholestyramine, maybe. And that specifically hinders the absorption of vitamin D. Specifically, we all need vitamin D. It's like, especially with winter setting in, we want to make sure that we're getting enough vitamin D so it doesn't affect our state of mind. A second medication that can contribute to the inability to metabolize folate is sulfasalazine. Again, I don't know if I'm pronouncing it correctly, but sulfasalazine. And why is folate important? Because it helps tissues grow and it helps cells function. So it works with vitamin B12 and vitamin C to help the body break down, use, and create new proteins. So if we're not getting protein, if we're not absorbing protein to begin with, because of malabsorption, because we're not absorbing we're not taking in the calorie, we're not getting the calories that we need, we're not absorbing it, then if that medication is being utilized, then our body is not able to create new proteins in addition to not absorbing the proteins that we are trying to eat. It also helps to form red blood cells, which that in itself helps to prevent anemia. Steroids are another thing that people sometimes use, maybe to enhance their exercise program or physique, whatever you might want to refer to. But steroids tend to reduce the body's ability to absorb calcium, okay, which we need for a strong structure. Chronic diarrhea. So, as I mentioned, prednisone can cause chronic diarrhea, but also just the conditions themselves. Sometimes the diarrhea is a symptom of that in itself. So when we have chronic diarrhea, then magnesium is lost. Magnesium doesn't get absorbed. And magnesium is a very important key mineral for bone growth and other body processes. So what are some of the symptoms of malabsorption? Bloating, gas, stomach cramping, bulky fatty stools, chronic diarrhea, as I mentioned. And in severe cases, it could be fatigue or sudden weight loss. So if you don't know if you have any of these bowel conditions, such as Crohn's or celiac or IBS or something else, if you're not aware of it, but you're experiencing some of these symptoms, it might be something that you want to get checked out. So I hope this has been beneficial, and hope everybody else can have a great rest of the day. Bye now.